Tear Trough. Use 16 mono 29G 30mm and 4 mono 29G 40mm by V SoftLine. Now we continue with Tear Trough and the lower eyelids. We use the same syringes as for upper eyelids, mono 29G 30mm. Now I put 2 syringes on top of the skin to check where to place the point of entry. I have already anesthetized this area before starting the treatment, using local anesthetic. In this area, it's imperative to use delicate finger movements. You have to keep track of where the needle is all the time. It mustn't be placed too superficially. And underneath, we have the canalis lacryvalis. And further below, also one of the ophthalmic lateral arteries, so you mustn't go too deep. Now placing one syringe in this direction. And now the other 8 vertically, like this. Hey, Doris. Please look up for a second. Now watch carefully how I maneuver the needle point. I have full control. I see exactly where the needle point is. Close your eyes. Open your eyes again. I watch where the needle is. It is important to have flow when you treat this area. Tear trough is a sensitive area, and it's crucial to place the needle correctly at the first trial, not having to withdraw the needle and redo the entry. Imagine being on the patient side. Except for a great result, you want the treatment to be as fast and painless as possible. When you're having a good flow, the maneuver is smooth, and the entire procedure is quickly pursued.
Tina är lite lättblödande också som tidigare. Och nu blir det lite känsligare.
Knowing that this patient bleeds easily, it makes it even more crucial to be careful. Some patients don't get any bruising or hematoma at all, though it may show up a few days later. And now the first eyelid is done. Now, let's do the left lower and upper eyelids. Tear trough, that is, the lower eyelid. And then we do the crow's feet laterally. We already did the upper lateral, now we do the lower lateral. Now we place 2 syringes, first like this, and this in a triangle format. Look and measure where to place it. Then we enter. Pay attention. I always know exactly where I have the needle point. Draw it back. Next thread. It's good to follow along with your fingers to stretch the skin, working bimanually with both your hands. Tiny, gentle movements when positioning the needle. Now 8 vertical threads.
8.
In this area it is important with good local anesthesia, since it is close to the nasal root, which is a sensitive area.
Här är det viktigt med bra lokal bedövning för det är nära näsroten, ett känsligt område.
Open the eye, please. I check that the needle is positioned exactly where I want. Tear trough requires carefulness and attention to detail, so you must take your time. Give it some time. You must never be in a hurry when you do the eye areas. Measure where to position the needle.
Fungerar lokalbedövningen, Tina?
Ja.
Ja, bra.
Basically, you may follow the shape of the eye,
Princip att
like
följa
this.
ögats form så här då.
Now we are approaching the end of treating the eyes.
Ja, slutet på ögonen.
The treatment of the eyes. Here we have a small hematoma.